All right, so why don't you start out by giving us a quick introduction about yourself and how you got to where you are today?
Absolutely. So, hello, everybody. I'm Donna Mazzola. And from a medical background by training, I am a PharmD. So, I graduated pharmacy school in 2006. And in my training in pharmacy school, I always had a passion for preventative health and medicine. And so, after my training, I completed a residency, postgraduate residency at the Detroit Medical Center, where I was exposed to ambulatory care practice. And for those that maybe don't understand, that means more of like the outpatient doctor's office work. And so that's where I practiced in that space for about 10 years. Managing patients with chronic illnesses like diabetes, heart failure, asthma, things like that. And I found that in my time in doing that as a clinical pharmacist, I was educating people primarily on lifestyle modifications and nutrition and diet. And that's not something we typically focus on as a pharmacist, right? We focus more on medicine. And so I found that to be my true passion. And when I was personally diagnosed with Hashimoto's, which is an autoimmune disorder in 2015, that's when it was kind of like I felt like it was my mission and calling to go back to school again and get a master's degree in functional medicine and human nutrition to complement my pharmacy background. And so with that, I started a blog, Dr. Autoimmune Girl, to create a community around that autoimmune audience that really highlights lifestyle interventions, nutrition factors, and how to really balance nutrition and medicine, because there's a true gap in care in that regard. And so, like, as a pharmacist, I was never trained in that. And it wasn't until it hit me personally that I realized there's so much that is missing out there from that regard. And so it's kind of the purpose of my blog. And I still practice professionally as a pharmacist. I say like in my real job, but I do this on the side, and it's fun and it's giving back, and I'm able to contribute back and help people on a larger scale because of social media. So it's exciting.
That sounds great. So could you please give us a description about your day-to-day experiences in your field and what a normal workday would look like for you?
Yeah, so my day-to-day job actually, so I've worked as a pharmacist, I'll say, in the inpatient hospital setting, in the outpatient setting, in the insurance space. And currently I work actually within the pharmaceutical company realm. And so and what I do there is creating medical strategy. So it's completely different than what you would anticipate a pharmacist to do, but really we're looking at products within our pipeline, products that are currently on the market, and how does it fit the population in need? What type of research or data is needed to be generated for these populations? And you know, how do we do that so that when we are bringing these products to market that we're putting so much forth, that there's access to them for patients, and so that we are making a difference in impacting their disease state.
All right, and in those experiences, were there any major challenges that you may have had to overcome? And if so, what are they and how did you overcome them?
Yeah, of course. So there's always going to be challenges in any job. And I think that professionally, as you grow your career, one of the biggest challenges is identifying where you want to grow. And so I think the beauty of the pharmacy profession, as I've stated with all my experiences, is that there's lots of opportunity out there. And you're not just pinpointed to what most people understand as like the retail pharmacist, you know, dispensing medication. There's so many more opportunities. So I think that was my biggest challenge, is identifying where in the field of pharmacy I really wanted to practice and make that impact. And fortunately, I was given, you know, provided those opportunities to kind of jump from space to space to finally realize, you know, where my home is. And so I think that that's important to recognize. And, you know, you overcome those challenges, and, you know, a lot of people say, I don't like my job, I don't want to do this. And so you grow, you advance your resume, you get additional certifications, you recognize where you may have gaps, and make yourself more valuable so that you can, you know, seek new opportunities in the space.
Okay, one last question. So before we, okay, yes. So what information do you think that high school students should know before they commit to this career path?
First of all, you need to know that it's a lot of math and science. So that's number one. And if you don't like chemistry, you might want to reconsider. And so, like, recognizing, you know, where the education is going to lie primarily is in that space. Recognizing that, you know, it'll be a long 8 years to going through the process, but in the end, you know, you have to identify, especially if you want to do the medical space, right? There's so many different opportunities, from nursing, physician, PA. What is it that you want to impact, you know, in a medical standpoint? And the pharmacist really is probably one of the most trusted professions, one of the most accessible professions in the medical space, right, for people to ask questions. And I think a biggest thing, just based on my experience and my career path, is really understanding that there are a multitude of areas that you can practice, and it's not strictly the retail space. So if you're considering pharmacy, it's absolutely a great profession, but to just research and better understand, like, what the different areas that you can practice in are, because I think a lot of people may not, you know, go into this career because they don't understand that aspect of it, and the description of a pharmacist, you know, on TV is not truly what it is in reality.
All right, so thank you so much for answering some of our ground questions. And now we're going to move on to questions we collected from students. And to start off, so there's been a lot of talk recently about the rising prices of pharmaceutical drugs. So what is your view on the pharmaceutical drug pricing debate?
Yeah, I mean, that's a challenging one. And so what you have to remember for pharmaceuticals is that so much goes into research and development, and that costs a lot of money, billions of dollars. So billions are spent on a molecule, several molecules. And when we approve medications and when they go through the process, they go through a phase 1, a phase animal studies, and then they do dosing and safety studies, and then they test it on humans. So if we say there's thousands of drugs that go through phase 1, maybe 100 of them pass on to phase 2, and there might be 1 or 2 that actually go to phase 3. So you think about the amount of dollars that are invested early on to try to research a molecule, but how many actually pan out is really a small set number. So understanding kind of the background of the dollars that goes into research and development for molecules impacts the pricing of it as well. And so you have to be able to make that money back that's invested, but also take that money that's made and reinvest as we continue to research. So the research game never stops. And so I think that's one thing that is never highlighted, and it's important for to recognize.
Okay, the next question is, what gender and racial disparities have you noticed in your field, and how have they impacted you?
Personally, actually, I'll take that back. Personally, I have experienced disparities myself. So when I graduated from pharmacy school, I was 22 years old. So I graduated high school very young, and I got into graduate school very young, which was all great. But when I got into the workforce, I experienced age and gender discrimination, quite honestly. And so, I had an experience where myself and my partner at our retail store graduated at the same time, but he was male and he was older than I was. And when it came down to promotions, my manager actually said, we're going to give it to Joseph because he has more experience than you. But in reality, he didn't, but he was older than me. And so, you know, I left, to be quite honest. So that's how I handled that. And actually, I did leave and pursued a career elsewhere. But you know, I think if you do graduate young, like that's something that, I mean, we talk about racial disparities and things, but I don't think age discrimination for young professionals is discussed enough. And so I think that's an important one to just keep in mind and keep an eye out for, and recognize how you're going to handle it. I mean, I was very vocal in that, and I think that's good because that feedback needs to be given so it doesn't repeat itself. But that's one area that I think, you know, as young professionals to keep in mind.
Thank you so much on shining some light on that. I know a lot of people don't talk about age discrimination, but in a couple of our past meets where we've interviewed younger professionals like yourself, they've all talked about it, and I really think we need to shine more light on that. So thank you for discussing that.
Yeah.
So for our next question, in your field, what are the most significant changes caused by the COVID-19 pandemic?
Yeah, so for pharmacists, actually positive changes have impacted the field. And so under the, you know, some new, I believe it's the CARE Act, pharmacists were actually provided more medical practice activities as a result, and some of those being the ability to provide testing, the ability to vaccinate without a prescription. So pharmacists have been really at the forefront of vaccination and impacting this pandemic in a positive light. So that's all been wonderful, and I think it's given the general public a better appreciation for pharmacists and what we can do and in this arena. So honestly, I feel like it's kind of been a little bit of a catalyst to advance the profession a little bit.
Okay. The next question is, what were some things you had to give up or miss out on while you were studying medicine, and what parts were or like weren't worth it?
So, you know, in graduate school, you're busy and you're taking 18 credit hours of primarily science heavy load classes. And so you're probably studying a lot more nights and weekends than maybe some of other colleagues that may not be in medicine. So yeah, you do give up on some of that fun that may be occurring, and you know, you kind of have to set your priorities straight and identify where you want to put your time in, essentially. Um, but at the end of the day, you know, if it's truly what you want to do, the fun can come later, I always say. You know, so like once you have that degree and you have that stability, you know, you can still live life and enjoy it. And, you know, so don't feel like you're giving up so much of your time and you're missing out because you're in school studying medicine, because, you know, the reward at the end is definitely worth it. I was definitely very young, so that's not that it was a regret for me, but you know, it made it a little bit more challenging being so young in graduate school, and you know, that maturity, I would say, necessarily wasn't all there. So that was a bit of a challenge, but at the end of the day, I got through it, and here we are today.
So through it all, did you ever feel like it was too much and you should just give up? And if you did have those hesitations, how did you face it?
Yeah, of course. Of course I did. And so, you know, it's like finals week or that last exam, you know, you definitely just, you're like, I can't do it, especially in pharmacy school where you have a biochemistry, an anatomy, a pharmacology test, a final, all in the same week, you know? And so how do you manage that and space it out? And you're just like, I just want to quit. And I think the best way to manage that, what I would say and give advice, is to have a support system. with a group of friends, with family, with other people that are like in it with you. Be vocal, don't go through it alone, don't hold things in, because together, it makes you guys stronger and you can get through it. Everybody does it. As hard as it gets, you can get through it. And I think that's important just to remember and to lean on each other.
Okay, that sounds like great advice. So the next question is, if you had to go through the whole process again, would you change any part of it, or would you just keep it the same?
Yeah, I always say I tell myself I wish I would have like studied harder or paid attention more, because as you get older, you're like, oh yeah, I remember we talked about that, but I don't know if I went to that lecture or if I read those notes clearly. And so it's not that you can't relearn it or reread it later on, but really building that foundational knowledge and like ensuring that you go to every class, that you study well and prepare for those exams, because like truly that knowledge sticks with you forever. It's amazing how the brain works and how you can recall everything. Like sometimes I'm like, how do I remember all this information? But I think that would be one thing. I mean, because I'll admittedly say there were probably one too many lectures that I did skip out on or didn't study as hard. So I know when you're in the moment, you think it's okay, and it probably is, but that's one thing that I look back like, I wish I would have focused a little more in this area or that area.
All right, so thank you for answering all our questions so far with the amount of thorough thought that you put into it. And that's actually all the student questions we got. But if you have any more advice or anything you wanted to talk about that you didn't get a chance to cover yet, please feel free.
Yeah, I'll just say, like try to decide early the direction you want to go, and kind of create that plan for yourself. I think that's especially as you're graduating high school, like, for some, they just don't know. But if you can try to pin it down and create direction and create a plan and work off that plan, I feel like a lot of times it's a lot easier to manage and, work through. You can plan out your courses that way, plan out what you're going to do every semester, manage the workload as a result of it, decide when you're going to take testing, administrative testing, to get into the different programs. You can line it through your coursework as opposed to maybe jumping in blind and saying, oh, I'll just figure it out when I get there. I knew early on in my junior year, this is what I want to do. And I was able to do dual enrollment as a result my senior year and actually take 4 electives that applied to my degree. And so I was able to lessen my coursework. And so I was able to finish quicker, but then I didn't have such a heavy load. So I could focus on those classes and ensure that I get high grades so that I'm competitive when I'm applying. So those are just kind of some key advice. If you can plan early and kind of decide and make that impact, and it'll help you along the way. And don't give up if you don't get in the first time when you apply. There's nothing wrong with that. It's my dad graduated pharmacy school when he was 40 years old. He immigrated to this country, didn't speak a word English, and went back to school at 36. So it's never too late. So, if you don't get in the first year, even the second year, don't give up. If this is your dream, keep pushing, keep pursuing, and just, work harder to get there.
Oh, sorry. So we just had one more question actually come in from a parent.
Okay.
So they said the pandemic has scared everyone and so many healthcare professionals have lost their life. What do you want to tell the parents of rising medical leaders that will encourage them to support their children even more?
Yeah, I mean, I think that with the pandemic, there were a lot of lessons learned as well, with how things were handled in the beginning and with a lack of knowledge of the virus and protection for our healthcare workers. It wasn't the norm by any means, and we've never seen anything like this. And you know, the last time this happened was 100 years ago. You know, we hope and pray that this doesn't happen again. And if it does, it takes another 100 years before it does, and we're more equipped at that point to better understand how we're going to handle it. So I would say, like, don't be scared and don't shy away from it. Most of my friends are in the medical profession. My neighbors are, one is a critical care doctor and one is an emergency medicine doctor. So they were at the beginning and at the end, right, for patients in this pandemic. And they wouldn't change it for the world, for what the experience they got. And the reason they went to medical school, this really defined their ability to give back and to help on such a large scale, that's something they'll have forever. And so if the true meaning of going into medicine is to help others, then you know, don't let the pandemic scare you. I think there was just a lot of unknowns in the very beginning. I think we've overcome that, and hopefully we won't be in this obstacle again for many, many more years.
That sounds great. Okay, thank you so much for coming. This is so good. All of the advice you gave us. I'm pretty sure our members are going to love it, and we're going to post it everywhere so everyone can see it. And I have to say, I saw your website and everything. So my mom is a big fan. She follows you, and she told me about it. So then I was like, I have to reach out. So
Yeah.
website looks amazing, by the way.
Yeah.
And I'm seeing your blogs, and I saw you have some teas, I guess.
Yeah, I didn't even talk about that. but yeah, like the sky's the limit. Yeah, so I've created a herbal tea company as well that utilizes herbs that have been studied and backed by science to support the symptoms of their like indication that we have. So and I mean, I've carefully like created these formulas. They taste great and they work. But yeah, so it's something, again, like, it's not, I always say it's not limited to just doing what you practice. Like, once you have the knowledge, you can do anything. And like, I think I'm an example of that, and that I've ventured out in so many avenues and arenas. But without that baseline background in pharmacy, I don't think I wouldn't have never gotten to this point.
Yes. It looks really good. And I love how you talk about not just focusing on medicine and also looking at like different ways, like natural. It's
Yeah.
very interesting. Yeah.
Yeah, and I actually have some friends with autoimmune disorders, and after hearing their experiences and how tough it's been, I love that you're doing this work on your blog, and I'm honestly going to share it with them after this because I think it has things they need to hear.
Yeah,
And
that's the point.
we'll use our platform to spread the word
Yes.
too, because it's incredible work.
Thank you. No, I appreciate that. And that's the whole point of it. It's simply to, as I learn and research, I just want to empower people to know how to take control of their health. That's it, you know, and to be a reputable, credible source on social media, because that's also hard to find. And so that's kind of the difference that I'm trying to make with my blog.
Yeah, but thank you so much for coming. This was so fun. And definitely it being off sync, it's a lot more like easier to go back and forth, and with these questions, it was really interesting to try this new way. Yeah,
Perfect. No, and however I can help you guys, like, I'm happy to give back, especially for other students as well. So I'm glad I was able to do this.